If you've been waking up tired even after a full night of sleep, if your bones carry a dull, unexplained ache that nobody has been able to name, or if you've noticed your mood dragging, your balance slipping, or your body catching every illness that passes through, please don't just accept it's part of getting older as the answer. Because there is one vitamin deficiency so quiet, so widespread, and so frequently unchecked in adults over 60 that millions of people are living with it right now and have absolutely no idea. Most of them have never had a single test for it. And the fourth sign on today's list is the one that sends patients down the wrong path for years, treated for something else entirely, while the real cause goes completely unaddressed. I'm Dr. Sarah Lane, and I've spent years working with adults who turned their health around once this one quiet deficiency was finally found and corrected. So let me walk you through the 7 silent warning signs that your vitamin D is dangerously low, in order with the most overlooked ones first, and exactly what you can begin doing about each one. Now, before we get into the signs themselves, I want to give you something even more important. The reason this deficiency is so easy to miss. And it isn't complicated. Vitamin D doesn't behave like most nutrients. Your body is designed to make the vast majority of it from sunlight, specifically from a type of ultraviolet radiation that hits your skin and sets off a conversion process that runs through your liver and then your kidneys before the active form finally reaches your blood. After 60, every step of that process slows down. Your skin's ability to make vitamin D from the same amount of sun exposure drops by more than half compared to when you were young. The liver and kidneys that handle the conversion often become slightly less efficient with age. And many adults over 60 are spending more time indoors, using more sunscreen when they do go out, or living at latitudes where the sun simply isn't strong enough to do the job for months at a stretch. Those things stack quietly on top of each other, and a standard multivitamin with a modest vitamin D dose often isn't nearly enough to compensate for all of that. It gets even more specific when you look at who is most at risk. If you carry extra body weight, vitamin D gets drawn into fat tissue and taken out of circulation where your body needs it. If your skin is naturally darker, you need significantly more sun time than someone with fair skin to produce the same amount. If you have celiac disease, inflammatory bowel conditions, or have had bariatric surgery, your gut may not absorb vitamin D reliably even when you're actively taking it in. And several common medications, corticosteroids, certain cholesterol drugs, and some anti-seizure medications can interfere with vitamin D metabolism in ways most people are never told about. This is part of why more than 40% of American adults have insufficient vitamin D levels, and the rates in the over 60 population are even higher. Now, here is what your body may already be trying to tell you. Warning sign number 1 is persistent fatigue and a deep bone-level aching that rest doesn't fix. And I want to be precise about what this actually feels like, because fatigue is one of those words that gets used for everything and ends up meaning nothing. The kind of tiredness connected to low vitamin D isn't the ordinary tired you feel at the end of a full and busy day. It's the kind that greets you in the morning before you've done anything at all, a heaviness in the limbs before your feet even hit the floor. It's the tired that doesn't lift after a good night's sleep, that stays through a quiet weekend, that makes ordinary tasks feel harder than they have any right to. Alongside that fatigue, many people notice an ache that lives in the bones rather than the joints, in the legs, the hips, the lower back, the arms, a dull, deep heaviness that's different from the sharp, localized pain of an injury or the grinding stiffness of a worn joint. Patients describe pressing on their shins or their thighs and feeling that the bones themselves are tender. This isn't imagination. When vitamin D is chronically low, the body can't absorb enough calcium to properly mineralize bone tissue, and that slightly softened bone under the pressure of normal movement and muscle pull creates a very real and distinctive aching sensation. Research has found that adults with documented low vitamin D levels score meaningfully worse on fatigue and quality of life measures, and that correcting the deficiency over the course of several months consistently improves energy levels and reduces that bone level heaviness. The pivot I want to offer here is that persistent fatigue and bone aching can also come from thyroid problems, anemia, and a number of other conditions that genuinely need their own evaluation. The goal isn't to blame everything on vitamin D, it's to make sure vitamin D doesn't get quietly skipped while everything else is being looked at. because it is one of the most common and most correctable causes hiding in plain sight. That's warning sign number 1. Warning sign number 2 is muscle weakness and a growing sense that your balance and steadiness aren't quite what they used to be. This one deserves to be taken seriously, not because weakness is uncomfortable to live with, but because the downstream consequence of weakness and poor balance at our age is falls. And a fall after 65 can change everything. A fractured hip, a hospital stay, a long and difficult rehabilitation, a loss of independence that is very hard to fully recover. So when something is causing or contributing to unsteadiness, finding it matters deeply. Here is what most people have never been told about vitamin D and muscle. It isn't just about bones. Muscle tissue itself has vitamin D receptors, and vitamin D directly influences how efficiently muscles generate and release force. When D is low, muscles fatigue more quickly, coordination becomes less precise, and reaction time slows in ways that are subtle at first and significant over time. People notice a little extra effort to get out of a low chair without using the armrests, a staircase that feels harder than it did last year, an unsteadiness on uneven ground that wasn't quite there before. Studies have specifically looked at whether supplementing deficient older adults with vitamin D reduces fall risk. And the numbers are genuinely meaningful. Some well-designed trials have found reductions in fall risk of 20 to 30% in adults who were deficient and corrected. That is a significant return for something as straightforward as correcting a vitamin level. The honest pivot is that muscle weakness has other causes too: low protein intake, thyroid conditions, certain medications, and all of them deserve attention. But vitamin D is an easy and measurable piece of that puzzle, and it shouldn't be overlooked. If your legs have felt less reliable or less steady than they did a few years ago, please bring that up with your doctor and make sure vitamin D levels are part of the conversation. That's warning sign number 2. Warning sign number 3 is a low, flat, or inexplicably heavy mood. And I know that when we feel down, we naturally reach for life circumstances to explain it, and often those explanations are entirely valid. But sometimes there's a quiet physical contribution underneath the emotional weight, and if it's never found, it never gets addressed. Here is what the biology shows us. Vitamin D receptors are present throughout the brain, including in regions that regulate mood, motivation, and emotional resilience. Vitamin D appears to influence the production and function of the neurotransmitters, the chemical messengers that set the baseline tone of how we feel day to day. Epidemiological research has consistently found associations between low vitamin D levels and higher rates of depression and low mood, particularly in older adults. Some clinical trials have found improvements in mood scores when deficient individuals are supplemented over several months, though the research is nuanced and the effect size varies across studies. The relationship is consistent enough and meaningful enough that it should not be ignored. Here's the pivot, and I want to be genuinely careful about this one. If you are struggling with significant depression or a serious mood disorder, please do not treat a vitamin as a standalone fix and forego other help. Depression is a real medical condition that often needs real treatment and real support, and vitamin D is not a replacement for that. What I am saying is that low vitamin D is one of the physical correctable contributors to a flat or heavy mood. And in an older adult who is also experiencing fatigue and bone aching and other signs from this list, it absolutely should be checked before anyone accepts that how they feel is simply the emotional weight of aging. That's warning sign number 3. Now we come to number 4. The one I mentioned at the beginning, the sign that most doctors never check for and that sends patients down the wrong road for years. Warning sign number 4 is deep, widespread bone pain that has been attributed to arthritis, when the true driver may be something else entirely. There is a condition called osteomalacia. It is essentially the adult form of rickets, caused specifically by severe and prolonged vitamin D deficiency. And one of its defining features is a deep, diffuse pain that lives inside the bones themselves. The hips, the spine, the ribs, the thighs, the shins, not in the joint space, in the bone, and it is characteristically tender when you press firmly and directly on the bone surface. Here is the problem that plays out in doctors' offices across the country every single day. When an adult over 60 comes in with widespread aching in the hips and lower back, the most natural explanation is arthritis. And arthritis may genuinely be present. Degenerative changes are common, they show up on imaging, and they attract all the clinical attention. But when osteomalacia is also there, unrecognized underneath, it disappears inside the arthritis diagnosis. Anti-inflammatory medications are prescribed, physical therapy is started, imaging studies are ordered and interpreted. And the vitamin D level never gets checked because no one paused to think that far. Patients stay in pain for months, sometimes for years. And all the while, a correction that takes 3 to 6 months of adequate vitamin D and that can dramatically improve quality of life is sitting right there, unclaimed. The clinical pattern that should prompt a vitamin D test is this: bone pain that spreads across multiple areas of the body, including places where classic osteoarthritis would be unusual. Osteoarthritis tends to concentrate in load-bearing joints, the knees, the hips, the base of the thumb, the lower spine at specific levels. Pain that spreads into the ribs, the sternum, the forearms, the upper arms, or the shins, especially pain that is tender when you press directly on the bone rather than at the joint botch, is a different pattern. That pattern in an older adult who is also fatigued and spending little time outdoors is osteomalacia until something rules it out. I am not saying skip the arthritis workup. Arthritis is real and it matters and it needs proper care. What I am saying is that the 25-hydroxyvitamin D blood test, a simple, widely available, inexpensive blood draw, should be part of the workup whenever widespread bone pain is present, especially in the absence of a clear inflammatory pattern. Because finding a low vitamin D level in someone with that kind of bone pain means there is something highly treatable contributing to the suffering, and missing it is unnecessary when the test is this accessible. The question to ask your doctor is simply, given my bone pain, can we also check my vitamin D level? That question, and the answer that follows, can change the entire trajectory of how someone feels. That is warning sign number 4. Warning sign number 5 is getting sick more often than you feel like you should, or taking noticeably longer to recover once you do. And this is the connection that most people have genuinely never heard, even though the research on it is remarkably consistent. Vitamin D is one of the most important regulators of the immune system in the human body. It activates frontline immune cells called monocytes and macrophages that mount the early defense against infection. It promotes the production of antimicrobial peptides, compounds that help the body fight bacteria and viruses directly at the surface level, and it helps calibrate the overall immune response so that it's effective without becoming excessive. When vitamin D is low, that entire system runs slower and less efficiently. In daily life, this shows up as a susceptibility that seems slightly elevated compared to what you remember. Getting a respiratory infection twice in a winter when you used to get one. Taking 3 weeks to recover from a cold that used to clear in 10 days. A chest that seems to stay congested far longer than it should. A large analysis that pooled results from many clinical trials found that supplementing vitamin D in deficient adults meaningfully reduced the risk of acute respiratory infection, with the strongest benefit seen in people who were most deficient and who supplemented consistently. The pivot here: how often you get sick is also shaped by sleep quality, stress levels, the health of your gut microbiome, and how much close contact you have with other people. Vitamin D is not the whole story, but for an adult over 60 who seems to be catching everything that comes around and hasn't had a vitamin D level checked in years, it is a straightforward thing to put on the table in the next conversation with your doctor. That's warning sign number 5. Warning sign number 6 is hair thinning that's progressing faster than seems right for where you are in life. And I'll be upfront with you, the research on vitamin D and hair is real, but still developing, and this sign carries less certainty than the earlier ones on this list. What we know is that vitamin D receptors are found in the cells of the hair follicle, and that vitamin D appears to play a role in the cycle of hair growth, specifically in signaling follicles to move out of the resting phase and back into active growth. When D is chronically low, more follicles may remain in that resting phase for longer than they should, and the result is a diffuse, all-over thinning across the scalp rather than a clearly patterned loss. This kind of thinning is different from the hair loss driven by genetics or hormonal changes, which tends to follow a more predictable pattern concentrated at the temples or crown. The vitamin D related pattern tends to spread across the whole scalp relatively evenly, and some research has found it slows or partially reverses when the deficiency is corrected. Here's the honest pivot. Hair thinning after 60 has many causes: shifts in estrogen or testosterone, iron deficiency, thyroid changes, stress, inadequate dietary protein, and yes, the natural changes that come with time. If this is a meaningful concern for you, please do have a proper evaluation that looks at the full picture, not vitamin D alone. But if you're noticing faster than expected thinning alongside several of the other signs from today, that pattern is one more reason to run a complete nutrient panel and include vitamin D in it. That's warning sign number 6. Warning sign number 7 is slow wound healing. Cuts, scrapes, and bruises that take noticeably longer to resolve than they once did. People often set this aside as an ordinary part of aging. And while it's true that healing does naturally slow with the years, vitamin D plays a specific role in the repair process that can make that slowing significantly worse when it's low. Vitamin D helps regulate the inflammatory phase of wound healing, making sure it's effective but not drawn out unnecessarily. It supports the growth of new epithelial cells, the cells that close the wound surface, and it influences the signaling that coordinates the whole sequence of repair. When D is deficient, that coordination becomes less efficient. The result shows up in daily life as minor cuts that take 3 or 4 weeks to close cleanly when they should have taken 7 to 10 days. Bruises that linger on the skin for a month, a scrape from a fall that just won't settle down. Beyond the inconvenience, there's a real safety dimension to this. The longer a wound stays open and unresolved, the longer the window during which bacterial infection can take hold. And in older adults, skin infections can escalate in ways that are far harder to manage than the original injury ever was. The honest pivot, slow healing, is also connected to blood sugar levels, circulation quality, and nutritional gaps in zinc and vitamin C, so it deserves a broader conversation with your doctor that looks at the full picture. But vitamin D is a specific, actionable piece of that picture. And if it's low, correcting it has the potential to improve healing alongside everything else on this list. That's warning sign number 7. Now, if any of this has felt familiar, if you've recognized one sign or several, here is what I want you to actually do with that recognition. Because knowing the signs is only half of it. The other half is taking one clear step forward, and I want to make that as simple as I possibly can. The first and most powerful thing, if your situation allows it, is sunlight. Not sunlight through a window. Glass filters out the ultraviolet B rays your skin needs to produce vitamin D, but real, unfiltered midday sun on exposed skin, your forearms, your legs, your back, somewhere between 10 and 30 minutes several times a week during the sunnier months, depending on your skin tone and where you live. This isn't an invitation to burn. Sunburn is always something to avoid, and it does more harm than good. But brief, regular, direct sun exposure is the most natural way your body makes what it needs. It costs nothing, and it has benefits that go well beyond vitamin D alone. The second thing is to look honestly at what you're eating. There are not many foods with significant natural amounts of vitamin D, but the ones that do have it are worth knowing. Fatty fish, salmon, mackerel, sardines, tuna are among the best natural sources and worth including 2 or 3 times a week if your diet allows. Egg yolks contain a meaningful amount. Beef liver provides some. Certain mushrooms that have been exposed to ultraviolet light, look for this specifically on the packaging, can provide a useful plant-based contribution. And many staple foods in the United States are fortified with vitamin D, including dairy milk, most non-dairy milks, and many breakfast cereals. So checking the nutrition label on things you're already buying is a simple place to start. The third and most important action I can give you is to ask your doctor for a 25-hydroxyvitamin D blood test. This is the specific test that accurately reflects your body's vitamin D status, not just a general vitamin panel, specifically the 25-OHD test. The number that comes back tells you and your doctor exactly where you stand and what, if anything, needs to happen next. A result below 30 nanograms per milliliter is generally considered insufficient. Below 20 is considered deficient. But what a given number means for you specifically and what to do about it depends on your full picture, your age, your health history, your medications, your other lab values, and that is a conversation to have with your own physician, not a decision to make alone. On the topic of supplements, vitamin D3, the most bioavailable form, is widely available without a prescription, and many adults over 60 genuinely benefit from regular supplementation. A range commonly discussed for general daily support is somewhere between 1,000 and 2,000 international units. But if your blood test comes back significantly low, your doctor may recommend a higher therapeutic dose, sometimes considerably higher, for a period of several months, followed by a lower maintenance dose once your level is restored. Please don't guess at the dose on your own. Vitamin D is a fat-soluble vitamin that stores in the body, and while true toxicity at typical doses is uncommon, it is possible at very high doses taken without monitoring. Let your blood test guide the conversation, and let your physician help you decide. So let's bring the 7 signs together one final time, because I want them to stay with you. Number 1, persistent fatigue and a deep bone aching that sleep doesn't relieve. Number 2, muscle weakness and balance problems that raise your risk of falling. Number 3, a low, flat, or inexplicably heavy mood. Number 4, the sign most often missed, deep, widespread bone pain that has been labeled arthritis, when osteomalacia from vitamin D deficiency may be the hidden driver. Number 5, getting sick too often or taking too long to recover when you do. Number 6, hair thinning that's spreading faster than seems right for your age. Number 7, cuts, scrapes, and bruises that heal more slowly than they used to. If you recognize 3 or more of these signs in yourself, that is not something to set aside and revisit later. It is a reason to pick up the phone and ask for a 25-OHD blood test. The test is simple. The result is clear. And if your level comes back low, what comes next is almost always manageable. More consistent sunlight, a few food changes, a supplementation dose guided by your actual number, and a recheck in a few months to confirm the level is moving in the right direction. Vitamin D is one of the few deficiencies where correcting it can genuinely change how you feel day to day. Your energy, your mood, your strength, your immune resilience, the steadiness of your balance, and the comfort of your bones. That is not a small thing at any age. I put together a short free guide with all 7 signs, a simple checklist you can bring to your next appointment, and the specific question to ask your doctor about the vitamin D test. You'll find it in the description below and pinned in the comments. Go grab it, it's completely free, and I'd genuinely love to hear from you. Did any of these signs surprise you? Or have you already gone through the experience of getting your vitamin D level corrected and felt the difference? Please share that in the comments, because someone reading this today needs to hear that it gets better. And as always, a gentle but important reminder, everything I've shared here is for education and general information. It is not personal medical advice, and vitamin D is genuinely something to confirm with a blood test and to discuss with your own physician before making any changes. If you're already taking medications, particularly corticosteroids, blood thinners, heart medications, or anti-seizure drugs, vitamin D supplementation is specifically something to review with your doctor first, because interactions are possible. Please don't make decisions about your health based on a video alone. If this helped you understand your body a little better today, I'd be grateful if you subscribed, so the next person who's been quietly exhausted and achy and wondering why finds their way here too. Take good care of yourself. I'll see you in the next one.